as you know, this roundtable is being sponsored by Alcon. Now, having said that, I would still like to have some discussion comparing and contrasting the Air Optics Aqua Multifocal, the Biofinity ProClear Multifocal design, the Oasis Multifocal, and the Pure Vision Multifocal. We're not looking for an advertorial. We're not talking about it from that standpoint. I'd really like to know what you feel. Let's discuss design differences that you feel are appropriate, any fitting differences, if any, comfort differences, if any, and resultant vision at distance, intermediate, and near.
Well, first of all, before we even talk optics, those are 4 very different materials.
Exactly.
And each one of those materials performs differently on the eye. And I think it is important for each doctor to understand the differences in those materials and understand how they behave in their practice with their patients and what they expect simply, forget optics for a second, but what they expect simply on a material standpoint. And that's going to be comfort, it's going to be deposition, it's going to be longevity of lens wear. There's definitely differences in those 4 materials.
And all of them work. All those plastics work.
But you have to know who you're putting them on.
Absolutely. And the other component is all of these designs work. You know, they all work for certain individuals at certain times. And there may be some patients who may not be in one design but can work in the other. So it's wonderful that we have all of them in our toolbox. But as to Chris's point, we have to understand the differences in the plastics and the designs.
I agree with everybody what they're saying. I mean, I can't say that I have preferences on lenses that I use, especially as first line, but I feel comfortable fitting any one of the brands that are out there today.
Okay.
And I want to talk to, because it's funny because I have 7 technicians I work with, and sometimes each of them have their preferences, and remember, they sometimes pick the lenses. I happen, and I know this is an Alcon forum, and I'm not doing commercials, but I truly believe the Air Optics is usually our lens of choice because of the comfort at end of day is amazing in that product.
Well, that's what I want to get into here, and that's specifically, your clinical results with Air Optics Aqua Multifocal in your practice. So let's talk specifically about that. What is it you like about the lens? You're saying comfort. That's one of the big issues. That's one of the things that you really do like about the lens. Is that correct?
The percentage of people, the number one thing I like about, remember, this is a long process. And I probably could fit 70% of patients in any one of the 4 lenses. I truly mean most of them are interchangeable except for one. I don't want to talk about the one that's not.
We all know the one.
We all know it. But the majority of the lenses I could interchange on patients year to year if they're that good. But I feel there's a slight advantage to the Air Optics at the overall percentage of people that day one they're going to leave 20-25 distance and near. Is higher with that product. And I also know when they come back at 2 weeks, and we discuss how was your vision at the end of the day and how was your vision in a restaurant, because we ask those questions. And it seems at the end of the day, the Lotrifilcon material does not dry out as much on the eye as some of the other lenses. And a lot of these people have dry eye.
Yeah, I have to speak to that, and I totally agree with you, Jack. One of the other components that is nice about this particular design is the asphericity of it, and how it gives a better full range of vision. And that is one component that really stands apart in it compared to some of the other designs which may have one eye centered more for the distance or one eye centered more for the near, or be geared towards a certain distance or in a range more than the other.